Okay, Saune Ramkabir, Jai Shri Krishna and Namaste. On behalf of Ramkabir Mandir, we really thank all of you for taking the time today to attend this very beneficial heart health seminar. And we are hoping, and we sincerely hope, that by implementing some of the tips which we give in this seminar, it will improve your lives, plus it may also prevent a sudden cardiac arrest. And for this seminar, on behalf of the Mandir, we like to really thank Dr. Nitinbhai Shah and his team of health professionals for taking the time to organize this seminar, which is going to be beneficial to all of us. So let me invite Nitinbhai, Dr. Nitinbhai, to really come forward and give a brief background of the seminar, and also give a background of the other health professionals we have with us today. So Nitinbhai, again, thank you so much. Now the stage is yours.
Thank you, Manubhai. Ramkabir, everybody. It certainly does not feel. Hey, Kiritbhai, Taru cordless mic. It does not feel very new to be here. It's just that I haven't been here in last probably 10-15 years, but otherwise, this is where we used to do pre-community health fairs, and many of you have taken advantage of. Can we move to slide number 3? So, what has prompted us here goes back to many years, which I'm not going to take you to, but do you have an answer for this question? Is there anyone here who does not know one person who suddenly dropped dead? If there is anyone, please raise your hand. There is no one, simply because that is the truth. And if you ask me, we go back to 20 years or 22, Rupesh and Hitesh, and of course, once I can correct me, 2005 is what I remember, but we also had one of the Bhakta community member at the similar event, and we lost him. And now we are standing here. In the last 6 months, actually, we have lost 3 people that I knew. One of them I never met, but he was only 34, a medical doctor. 65, right here living in Cerritos. And of course, Roshanbhai at 47. And before it happened, actually, few years back, we have had this type of seminar by Dr. Bimal Chajar. He's a cardiologist in India, and he's been here twice, and I'll talk about it right in the end. So we just felt what has changed in 20 years is now we have some tests which are, nothing is perfect, but which are pretty close compared to 20 years ago. And I still remember when Jagdish passed away, we subjected all 3 brothers to go through full-fledged cardiac catheterization, nothing in between. Now, fortunately, we have something else, and we will talk about it, which is certainly less invasive and simpler. So with that, our first speaker is your own community member, Dr. Chitra Bhakta. Let me see if I can figure out my technology challenge about Dr. Bhakta's biodata. And after this talk, I promise you, આપણે ગુજરાતીમાં વાત કરવાના પછી. And but Dravidian speakers are going to speak in English, of course. So, who is Chitra Bhakta? She is a compassionate physician dedicated to helping patients achieve better health, not through the medications only, but personalized whole person care. And during her years of practice in Newport Beach, she is focused on integrative medicine. That's integrative means, most of the times, most of the doctors, we ask you questions and we give you pills or injections and done. But there is something called lifestyle, and that modification is what she is very fond of doing. And as a founder of Orange County Integrative Medical Center, Dr. Bhakta worked closely with patients facing chronic and complex health challenges and multiple different things. She believes that every patient is unique and that effective healthcare begins with listening, which many doctors don't do enough of, understanding individual concerns, and creating treatment plus those tailored to each person's needs. In today's presentation on cardiac care, Dr. Bhakta will share practical information about heart health, including ways to reduce cardiovascular risk, recognize early warning signs, and make everyday choices that support a healthier heart. Our goal is to provide patients and families with the knowledge and tools they need to take charge of their cardiovascular health and live healthier and more active lives. And hopefully, when we finish today, if nothing else, you will have some idea of what not only you, your children, your family, your friends can possibly do. And we will of course be there, not only today, but even afterwards, to help you with that. With that, please welcome Dr. Chitra Bhakta.
Can you hear me? Yes. All right. No, I prefer this. Okay, Ramkabir, everyone. So we're going to talk about heart disease because honestly, this is the #1 problem in South Asians. We're talking about Indians, Bangladeshis, Pakistanis, we are all part of South Asia and Sri Lanka. Next slide, please. Okay, so there are different types of heart disease. So I want you to take a look at the heart. It's just a pump. It's like a pump. Its job is to pump oxygenated blood that's carrying oxygen, which is required by all your organs and cells in your body to various areas of the system. And then when the oxygen depleted blood comes back to the heart, it pumps it to the lungs. And there you breathe out the carbon dioxide and breathe in the oxygen. It gets oxygenated, goes back to the heart, and it pumps that oxygenated blood to the rest of the body. This is why it is so important, because it's literally keeping you alive, both your brain and organs and other systems. Now it has different, you have different heart diseases. I don't want to go into major problems. The one that I do want to talk about is the last one, the coronary artery disease, because that's the problem with most South Asians. So the word coronary, it means heart. Arteries are any blood vessels that carry oxygen. So when you see the word artery, it means it's oxygenated blood. If it's not oxygenated, those are veins. They're carrying oxygen depleted blood. So coronary artery disease is a disease of the arteries of the heart. And then, that can lead to other disease problems. And I don't want to go into the rest. That's the main one that I'm going to concentrate on today. Next, please. So coronary artery disease in the United States, so we are talking of the general population, meaning Caucasians and other Asians and so on. 1 in 20 adults have coronary artery disease. That's about 5% of the population. So what is it? It's basically, like I mentioned earlier, arteries that deliver oxygen-rich blood to your heart, they either become narrowed because there is some kind of blockage that's occurring because of either calcium deposits or fatty tissues and fibrous tissue. And that reduces blood flow and can lead to a heart attack. So it's responsible for 80% of all sudden cardiac arrests, which is why it's such an important disease. Next, please. So what are the warning signs? Now, it can be a silent threat, which is why you have these sudden, people who seem very healthy, seemingly living healthy lives, who are suddenly dropping dead. And because the symptoms don't appear in many of these cases early on. It takes a long time before the symptoms come, and by then the damage has been done. So what are the things that you should be looking for? One is chest discomfort. So there's the pressure or pain or squeezing, especially during activity, and or they might say, I'm feeling short of breath, I'm not getting enough oxygen. Or they'll talk about pain that's either radiating down the arm or up the neck or onto the upper shoulder or back. Unusual fatigue. This is very, very common in women. Feel extreme fatigue all of a sudden. And lightheadedness or upset stomach. Upset stomach can be nausea or vomiting in extreme cases. So any of these signs, if you see, you don't want to wait around and try to figure it out for yourself. Please call 911 and get to the hospital and let the experts take charge there. And women often, I've written at the bottom, often experience fatigue, nausea, and shortness of breath rather than chest pain. In fact, a lot of women sometimes actually feel as though they're having nausea or some kind of abdominal discomfort rather than the classic chest pain. Next, please. So heart disease starts earlier than you think. So what the recent current literature is showing is that in your early 30s, you have to start looking after your heart. Okay, and 80% of all of these heart diseases are preventable if it had been caught early on and measures were taken. That means you have to be proactive, even though you might be asymptomatic and feel healthy. And the 30-year risk calculator is now available. And as I put a little, saying there, the biggest misconception is that heart disease is a problem of older age. It's not. It is a problem of younger people. In reality, it starts much earlier, early in your 30s. Next, please. So what are the new cholesterol guidelines? This is from the American Heart Association. You start screening at age 19. Your first screening should be then, especially in South Asians, because we are the biggest, highest risk people in this category. Consider blood sugar and kidney health. So get your sugar health checked and check your kidneys, which is a BUN creatinine, it's a blood test. And then, not just look at cholesterol. Cholesterol doesn't mean anything, or it could mean a lot of things. One-time LPA test, that is lipoprotein small a. Now, a little background on this, the National Health Service in Britain found in the 80s that a lot of Indians were dropping dead. And they were surprised because these were mostly vegetarians, they didn't drink or smoke, so they were wondering why are these people clogging up the National Health Services. And they looked into it and they found this genetic factor which increases this lipoprotein small a. The word is atherogenic, meaning it's a very sticky molecule. So it sticks to the inside of your blood vessels. Okay, so you do need a one-time. At age 19, first test, that's the blood test you should do. Check your sugar, check your cholesterol, check your kidney function, and then earlier treatment, of course, for high-risk younger adults. Now, the cholesterol numbers to know, LDL is bad. So if you have very high LDL cholesterol, that's not a good cholesterol. You want to keep it low because it builds plaques, meaning little obstructions in the walls of your arteries that's carrying the oxygen-rich blood. HDL is good. It means high density. Anything with a high number, larger molecules are good. The smaller the molecule, the more stickier it gets and starts sticking to the inside of your blood vessels. Triglycerides are bad. Those have to be kept low. Lipoprotein A, I told you that's a genetic factor, and it's now they're recommending testing it for every adult, not just South Asians. And ApoB, I tell my patients B stands for bad. So apolipoprotein B is a bad protein, and it's advanced a marker for high-risk patients. So you have to test that if you are in a high risk. But early on, like I said, you test your cholesterol, lipid panel, you test for the LPA one time, you test for your kidney functions. Okay? Next slide, please. Know your full heart risk. A normal cholesterol level is not the only measure. So, just because your cholesterol looks fine, my heart is good. That's not the reason. One is family history. This is huge. Okay, so if you have a family history, even if you have a normal cholesterol, it doesn't matter. You still need to go and get yourself checked. High blood pressure, silently damages arteries over time because it puts a lot of pressure into the walls of the arteries. Diabetes and high blood sugar also speeds up artery damage because, as you know, sugar gets converted to fat and bad fat in the liver. So that's why, they always say sugar is the main problem and we really need to reduce it or get rid of it from our diet. Especially the morning teas. I know a lot of Gujaratis love to drink it and they're pouring sugar into that and they have 2 or 3 cups. That'll do it to you over a lifetime. Obesity, it increases the strain on the heart. The other thing is the way our fat is distributed in South Asians is very different from fat distributed in other, ethnicities. And the reason is our fat tends to be located around the belly. And that means there's a lot of fat on the liver. The liver is producing a lot of fat, which is not good because your liver is your detoxification organ. Next is smoking and vaping. Poor sleep also will raise risks. So you have to look, if you have heart problems, you also have to look at your sleep history. You could be having problems with sleep, breathing at night and so on. Next, please. Okay, so they started a masala study in the United States, again because of high incidences of heart disease in South Asians. And the masala study stands for mediators of atherosclerosis. Atherosclerosis meaning sticky molecules, which affect your blood vessels in South Asians living in America. This was done over a 10+ year period. It started in San Francisco. They continued it, and recently they also included New York, where they included other South Asian populations like Bangladeshis and also Pakistanis. And what they found was, globally, 30% of people die of heart disease. But look how many die in South Asians of heart disease, 60%. Of that 30% are South Asians. The key findings was South Asians have a 40% higher chance of heart attacks compared to Caucasians. Number 2, insulin resistance and diabetes. This is huge. 20% of us are affected by them, which contributes to plaque buildup in the arteries, leading to heart disease. Visceral adiposity, they have a genetic tendency to store fat around the abdomen and the liver compared to the body mass, despite having a normal body mass index. That's why a lot of people say, well, that person's thin, they must be fine. No, you can be very thin and have severe heart disease. And the other reason is also because we have smaller arteries genetically, because we are smaller and shorter in stature. And last are lipid profiles. Of course, they build up plaque in the arteries. So what can you do? You start your cholesterol screening in your 30s. As I said, you really have to focus from your early 30s. Get a lipoprotein A test at least one time. If it's normal, fine. If it's not, then you have to follow up on it. Keep your family, know your family history, and this is very important, and speak about it to the physician. Don't just say, oh, I think I'm just coming for a cholesterol test. Say that, this is what happened in my family. These are the family members who have passed away because of heart condition. That will focus the doctor, more specifically. Reduce refined carbs, white rice, and fried foods. so sugars and stuff as well. Manage stress, because it does affect the heart. And of course, encourage the whole family to get interested. And I think this is where the parents should come in, because even today that I see, it's meant for younger people, and mostly it's filled with older people. And this is where I think the older, population needs to get the younger ones interested, and at least discuss with them at home as a takeaway of why it is more important for them to be worried about their heart than the older ones, because we've crossed that Rubicon almost. Okay, next please. So lifestyle is the foundation. You can go on prescribing medications, but if you don't change your lifestyle, nothing's going to happen. So Mediterranean diet, I mean, we do eat fruits, we have a Mediterranean diet. Our problem is we load it on with fats and sugars and fried foods. That's the problem. And that's where we have to focus on. Exercise regularly. And for older people, especially women, I don't recommend doing aerobic exercises and thumping around, because that really doesn't benefit them. It's better they do more weight training, even if it's 30 minutes a day, 3 times a week. And the rest of the time, go for a walk. Healthy weight, you do the body mass index for your healthy weight. So what you do is you take your weight in kgs and divide it by the square root of your height in meters. And that's how you get your BMI. Sleep 7+ hours, no tobacco or drugs, and limit processed foods. So all those things in packages are all processed. Remember that. Half the cheeses that we use are processed. So unless it's a pure cheese, you're buying a manchega or a pure cheese, Gruyere, that's fine. When you get these mishmash cheeses, those are all processed. All right, next please. Get screened. So what to ask your doctor? First of all, how often do you want to screen? Between the ages of 19, 29, every 5 years. Once every 5 years if you have no major risk factors. That means you're healthy, but you go every 5 years and get screened. Age 30 plus, every 5 years, or more often if your risks, you start showing higher lipoprotein A or other risk factors. If you're high risk, you have to check every year, annually. And lipoprotein A, once in your lifetime for everybody in the family, especially for South Asians, we must get that done. So standard lipid panel, it consists of LDL, which I said anything with a low number, L, is risky. HDL is good, triglycerides is risky, total cholesterol, start at age 19, a one-time lipoprotein A test, blood pressure check every 1 to 2 years, get a blood pressure check, and more often if elevated, and I'm going to expand on that a little more right now. Blood sugar test, you want to make sure you check. 30 risk calculator, you don't have to worry about it. So, hypertension. Now what normally happens when you go to see the doctor? You walk in, you sit in the waiting room, nurse comes and says, you're next. She takes you into the examining room, and she immediately brings the blood pressure stuff and everything, takes the blood pressure. While she's taking it, she asks you about your name and chats with you. You might be crossing your leg at that time. Then the doctor comes in with his white coat and he says, okay, let's just do another blood pressure check, and it goes even higher. Now let me explain all the wrong things over here. First of all, you don't do a one-time blood pressure check. That's not blood pressure. Your blood pressure keeps changing throughout the day. That's number one. Number two, when somebody is talking or there's noise or you're yelling on the phone and taking a blood pressure, it's going to go high. If there's pain, it's going to go high. Any stresses of any kind. Then some people cross their legs. It'll go high. Then the doctor comes in with his white coat. That's white coat hypertension. 1 in 3 patients have white coat hypertension. They see the doctor and it'll go high. So by the time these things start, 1, 2, 3, 4, your blood pressure will show 25 points higher than what it actually is. So that's not the way to do a blood pressure. And then the doctor says, okay, now I think you've got high blood pressure, I'm going to start you on a medication. And then if you're older, you might end up getting dizzy and fall down and end up with a fracture that will kill you. Forget the blood pressure. So how do you do blood pressure? Please do it at home. Everybody should, especially in the Indian community, South Asians should have a blood pressure machine. Make sure the cuff that you buy fits snugly. It shouldn't be too tight. So, if you have very fat arms, get a blood pressure cuff that fits well, or it shouldn't be too loose. Okay, that's number one. Number two, this is what I tell my patients. As soon as you wake up, sit for 5 minutes and just slow, deep breathe and calm down. Then sit in a chair, not with your legs crossed, feet firmly on the ground, sit straight, and then put on your blood pressure cuff and keep your arm at heart level. Take one blood pressure reading at that time. Then wait a minute and do a second one. Now you're done for the morning. Evening, you do the same thing twice again with 1 minute apart. Next day you do the opposite arm, same thing. Four readings, 2 in the morning, 2 in the evening. And you do it over 7 days, that gives you 28 readings. And then you average it out. Now that is your blood pressure. Now if you're 60 years and up, what happens? Like everything else in your body, your blood vessels get stiff. So your blood pressure goes even higher, because when the heart is pumping against something hard, it's not able to expand, and so it shoots up your blood pressure. Same thing when it's relaxing, which is the lower number, the diastolic, you're not able to contract the blood vessel because it's stiff. So it drops much more than it normally should. So what you do is, you do pulse pressure for 60 and up. That means you minus your top number from your bottom number. If it's between 40, 45, you're fine. 50 to 59, that's the minus number. It requires a little looking after. Anything at 60 over 60, that's what I tell my patients, is 60-60 is dangerous. Okay, you need to monitor it. So for people 60 up, a blood pressure is not the way to go for it. You have to look at the pulse pressure, because your arteries have become stiff. All right, so this is the way to get a good blood pressure. And for others, like I said, over a week, and take that number to your doctor and say, doctor, this is the number I have. Over a period of 7 days, taking both. Hello? Yeah. So please make sure that you take it over 7 days, do it twice in the morning, twice in the evening, and do it alternate arms each day, and then take an average. That is your actual blood pressure, because it keeps, remember, it sort of fluctuates throughout the day. All right, next slide, please. Okay, so what are types of plaques? So you've heard the word plaque. It's nothing but an obstruction inside your arteries. This is what causes the problem. So, we hear a lot about, what is your calcium number? We get all excited about it. That's the least dangerous. Okay, it's a hard obstruction. It takes a long time to build up. It doesn't break away. That's not the problem. The next one is the moderate risk. It's a mixed plaque. It has a little bit of calcium and a little bit of fat and fibrous tissue. The worst, which is where we all end up with those sudden heart attacks, are the low density, non-calcified. That means there's no calcium. It consists of fat in the middle, and it's wrapped around with the fibrous tissue, and it can be this small. There may be no obstruction in the artery, so you think you're feeling great, but it'll break off and then travel through that major blood vessel into a small one and block it. And if it's an important one, that's when you have those sudden deaths. Okay, so that's the most dangerous. So getting calcium numbers and all I'll explain to you, that's a different thing altogether. Next slide, please. So what kind of tests should you get besides the blood tests that we just spoke about? The first one is coronary, like when you see the word coronary, it really means the heart. CTA, which is computed tomography and geography, meaning it's a CT scan of your blood vessels. So it's really looking at the anatomy, okay? Looking at how well your blood vessels are and what do they look like. So it'll pick up things. What will it tell you? Is there a plaque? That means an obstruction. How much plaque? Is it soft, non-calcified, or calcified? It'll answer all these questions. You don't need another calcium thing. Is there any narrowing of blockages? Where are they located? And is there a high-risk plaque that could rupture, which is the soft one, non-calcified, okay? So what can it detect? early atherosclerosis, meaning diseases of the heart, blood vessels, mild plaque even before the symptoms occur, where you're feeling great and then you'll suddenly drop dead. Those are the patients. It will also pick up moderate or severe stenosis. Stenosis means narrowing of the arteries. So if there's very narrow passage, less oxygenated blood is going to flow through it. Also looks up for congenital coronary abnormalities. Those are blood vessels that you're born with, which are congenitally deformed. And then calcium burden, often combined with calcium scoring. It actually looks at the calcified thing. You don't need to get a special, calcium test unless you want to look at calcium scoring. Next, please. Okay, this is now the latest thing, cardiac PET CT. This looks at how well the blood flow. How well is your blood flowing through those arteries? Are they flowing adequately, or there is not enough blood flow going through? So what PET CT can tell you is enough blood reaching the heart, and are the arteries causing reduced perfusion, meaning exchange of oxygen into those tissues? Is there ischemia during stress? Ischemia is lack of oxygen into the tissues. So if there's any stress placed on the heart, then and if there is an issue of poor perfusion and less oxygen reaching those tissues, then it's a problem. Is there microvascular disease? So not just big arteries, even the small arteries and blood vessels, it can pick it up. Is heart tissue alive, viable after injury? In other words, if you've had a previous heart attack or previous heart attacks, you get scarring tissue sometimes in severe ones. It'll pick it up. So it's very sensitive for functional significance of blockages. And it's small vessel disease, reduced the balance ischemia, meaning poor perfusion, and prior heart damage or scar because of prior heart attacks in the past. Next, please. So this is just a comparison that I put because a lot of my patients were always getting confused. So what is coronary CTA versus cardiac PET CT? The coronary CTA actually looks at the blood vessel. It can actually look at it and say, there's a narrowing or there's a blockage or something. Cardiac PET CT measures blood flow. Okay? It's best for detecting plaques and stenosis. So for our purposes today, for the purpose of this talk, we're talking about CTA, artery disease, CAD. That would be the best test for it, probably. Cardiac is for detecting ischemia. So this is somebody who comes to the doctor and says, I feel short of breath, when I'm doing some kind of work, or I'm under stress, I get some pain. Then that might be the better test to do. Because it'll now, actually look, is your muscle tissue getting enough blood flow or not? Shows plaque directly, the CTA will do that. Detects early disease, excellent for CTA. That's why CTA is number one for that. Best for prevention or risk assessment, yes, because it's picking it up very early. And contrast needed, you do need, when you do a coronary CTA, you do inject iodinated contrast. So those people who are allergic to it, then it's better they just go and get the cardiac PET CT, because there you just use a radioactive tracer. It's a fluoride tracer which is attached to a sugar molecule called deoxyglucose, and that helps to pick up the flow of the blood. So this is the, I hope somebody is taking pictures so that you can talk about this to your families and everybody else. Next, please. Now, this is something that I'm asked all the time, Doc, do I need a calcium test scoring? Calcium test scoring is after you're detected with some calcified heart disease. It's non-invasive, it takes 10 minutes. It's a money-making procedure for the cardiologist, so he'll ask you to just get it done, whether you need it or not. It just checks calcium buildup in the arteries. Of course, nothing is used, no dyes are used. And main thing is calcium score. So if you've already got a calcified plaque and you want to know, has it built up more or not, then it'll give you a score. It gives you a percentile, not the actual quantity. So 0 means no evidence of plaque, 1 to 100 is minimal evidence, 101 to 300 moderate. Main problem is 300 plus. That means you have extensive calcification, calcified plaque buildup. Next, please. So, you know, the difference between the two is one gives you a calcium score. And as I said, that's only good if you already know you have a calcified plaque and you want to, you know, see how far it's increased or not. But coronary CTA is much more advanced. The only problem is it does require an injection of iodine. So if you're allergic to it, it's better to get a PET CT, which I had mentioned before, to visualize blood vessels and check for any soft, actually it even checks for calcified, non-calcified plaques. It checks both. So I would go with that CTA, that as a primary testing. Next, please. So what's your action plan? Get a lipid panel, lipoprotein A test, know all your risk factors. As I told you how to measure blood pressure, I think everybody should know how to do it on their own. Blood sugar, family history, so that way you can just tell the doctor, this is my blood pressure over 7 days, this is my family history. Then of course they check your blood sugar and everything. Mediterranean diet, as I said, we have the basics of the Mediterranean diet on which we add frying, oil and sugar. That's the problem. 7 hours of sleep, no smoking, and starting in your 30s is more powerful than treatment in your 60s. So be open to treatment. So that's the takeaway. Feeling healthy is not the same. Just because I'm healthy, so I'm low risk. No, it's not. It is take action today. You really need to check because we have, unfortunately, a genetic as well as a poor diet combination and short body build with thinner vessels. So we've got all the risk factors on our side, and we don't want to be waiting till we don't, we may not be even alive to say that I'm not healthy. That's the important takeaway. Thank you so much. It's been a pleasure.
Thank you very much, Dr. Bhakta. I think we are all expert now, right? Or at least if not, we need to go and tell our family about what we learned, and more importantly, what we all need to do. Next is Dr. Asa Patel. Ashaben is an Ayurvedic wellness practitioner, nutrition educator, and holistic health advocate dedicated to helping individuals improve their health through sustainable lifestyle changes. After studying Ayurveda from 2009 to 2013 at the Kerala Ayurveda Academy and Institute, she established her own practice and has since guided clients towards greater well-being through personalized nutrition, self-awareness, and preventive health strategies. At this cardiac wellness camp, Ashaben will share practical approaches to heart healthy living by combining Ayurvedic principles with modern nutrition and lifestyle practices, empowering participants to make lasting changes that support cardiovascular health. And the most important, many times we feel, we know, we think, oh, this is the man's problem, women don't get much heart attacks. I had asked for some research from my grandson, and he came up with many things, and one of them is women are no exception. And the best example is Ashaben herself. She is a survivor of heart attack, and I'll let her tell the story. Ashaben, thank you.
Namaste, Jai Shri Krishna, Jai Ramkabir. First of all, I'd like to thank Nitinbhai for giving me this opportunity, as well as the Bhakta community members. My name, like he said, it's Asha Patel. I'm an Ayurvedic practitioner, so you'd think I'd be really healthy. And I thought I was really healthy. I was active, I worked a full-time job, I had an Ayurvedic practice on top of that, I was taking care of elderly parents, and I was raising children all at the same time. So years earlier, I'd been diagnosed with diabetes. My father was suffering from diabetes. I took it, and with the Ayurvedic principles, I basically overcame it. And I was back to normal. I didn't have to take medication. Well, 6-7 years ago, my life drastically changed. I had several members of my family within the last 6-7 years who have passed away, majority of them through cardiac issues. And my father-in-law, my dad actually passed away from complicated diabetes, which ended up having heart issues. Now, I was always proactive. I know Chitra just talked a lot about what I went through, but I was always proactive with my health. I went every year for my checkup. I did regular EKGs. I had a calcium score test done, and I was classified as being healthy. So I believed I was being protected by doing what I could. What I didn't fully appreciate was that stress, grief, and genetics, as well as diabetes, plays a very big role in your life. My brother and my mom both passed away from severe heart issues. I went to my doctor after each one of them. I asked to be checked. He did an EKG, he looked at things and he told me I was fine, which is not true. Last year I was on a speaking tour in Asia. We've been on the road for nearly 2 weeks. I was in Nepal, and I woke up in the middle of the night, not feeling well, but didn't know what it was. I didn't have any classic symptoms of having a heart attack. I didn't have any of those issues. So all I know is I was under a lot of emotional stress. I had been diagnosed with diabetes again in the last 2 years. This time though, the medication they gave me was really hard for me to swallow. They were bigger pills. I ended up either choking or throwing them up or whatever, and I talked to the doctor. They said, well, you still have to try to take them. So I ended up missing a lot of doses, but I felt fine. My diet was fine, everything was fine, so I thought it's not an issue. Well, when I woke up that night, I tried to drink some water thinking I'm dehydrated. Didn't help. It made me feel worse. So I ended up waking one of my teammates up, and we ended up going to the closest ER, where they called in, they did some blood work, they realized what was going on. They called in the cardiologist, who did an echogram on me. And as soon as he did the echogram, he basically started making arrangements to move me to a larger facility because they didn't have the capabilities to treat me at that hospital. I was very shocked and very surprised when I got to the other side, and they did take me to the cath lab to here. I was 100% blocked. And at the same time, my body was also in a ketoacidosis mode, which is a very life-threatening condition of diabetes. So my chances of survival from this was less than 10%. Understand, I was on the other side of the earth from my whole family, in a foreign country where none of my teammates knew anybody, but I basically decided that I was just going to put my faith in God, and come what may, with all the grief I've been through and the loss, I understood that I couldn't control what was going to happen. I could only put my faith in the people around me and let them do their best. It took my husband 42 hours to get to where I was. In the meantime, I was stuck in ICU. My teammates could only come in for a brief 10 minutes a day and only one at a time. So they did their best. And then I just had to hang. Because luckily, I understood Hindi, but that doesn't help you when you don't know what exactly is going on, because I had no idea what ketoacidosis meant, and I couldn't understand how I was 100% blocked when I just had a calcium score testing done that showed I was mildly blocked. But that was because my plaque was soft, the most dangerous kind, like Dr. Chitra said. So I spent the time reflecting, praying, reflecting on my life and thinking, well, I should be grateful for what I've had so far, because I'm not sure whether I'm going to make this out of here alive. Thankfully, I did survive. Recovery for me has been very long and very challenging. In fact, last Friday was my 1-year anniversary from my heart attack. For months, and when I say months, it was 7 to 8 months, I had zero appetite. I could not eat. My family was really worried because without food, you have no energy. And without energy, you can't do anything. You can't move, you can't exercise. But looking back, now I understand. The reason I couldn't eat was because my body needed that energy elsewhere. My heart had been severely damaged because in order to get the health care I needed, it took me 5 to 6 hours when I was having the heart attack. Now, 5 to 6 hours can do a lot of damage in your heart. And for those of you that understand ejection fraction, I was down to 25%. So it wasn't doing well. But the one thing I learned was to listen to myself. Like I did that night. When I was tired, I would rest. When I had enough energy, I would walk around my house, even if it was 10 steps for that time. It was fine, I would do it. I'm just grateful that today I'm healthier, I'm stronger, and for that I have a lot of gratitude to my family members. But my experience has taught me, always listen to your body. Your body will tell you, even though I didn't have classic symptoms, my body woke me up and told me something was wrong. Now, the doctor warned me, when I went to the hospital, the doctor told me, 9 out of 10 people would have taken a Tylenol and gone back to bed. Had I done that, I would not be here today to give you this speech. But being an Ayurvedic practitioner and doing meditation and everything had taught me to listen to myself. And I was aware that something was drastically wrong. So I shared this story because many people believe that if they exercise, they get regular checkups, they have normal blood tests, they're protected. While these things are incredibly important that you get done, they don't eliminate your risk, especially when you have a family history of heart disease or diabetes, or if you have chronic stress. I know Indian women especially do undergo a lot of chronic stress. They tend not to talk to anybody. A lot of them have so much pressure on them that they don't take the time out for themselves. That will show up one day. Not every heart attack is going to come with a dramatic warning. There's no neon signs that says, you're a heart attack. I didn't have any classic symptoms. I just knew something was wrong. So I'm sharing this story today because I'm hoping that it'll help somebody save themselves. We can't control everything in life that happens to us, but we can take control of ourselves. We can listen to our body. We can cherish the people we love. And we can be grateful for every day that we are given, because there are no guarantees in life. Doesn't matter how old you are. I know I'm deeply grateful to be alive today and to be able to share this story with you. So that's my story with all of you today. Yeah? Okay. So after surviving that attack, I realized that healing requires more than a procedure or a prescription. So modern medicine saved my life, but the recovery required attention to nutrition, attention to movement, to stress management, to sleep, and to healthy daily habits. Now, some of you may be wondering why I'm reading, but let me tell you just off the thing. My memory has been affected by my heart attack and the lack of oxygen. So while before I could speak off without notes, I now do have to refer to my notes. So as an Ayurvedic practitioner, I wanted to understand how both the ancient wisdoms could work with modern medicine. I discovered that they both actually work really well together. So today I want to share some of these lessons that I've learned that have helped me on my recovery. So modern cardiology, as Dr. Chitra said, they provide life-saving treatments by helping you reduce your future risks, by controlling your high cholesterol, your blood pressure, your diabetes. Whereas Ayurveda will help you to adds to like a deeper understanding of your digestion, your lifestyle, your emotional health, and prevention through mind-body balance. They are equally important when you're recovering and to prevent yourself from getting into my body. So together they work and form a powerful framework for long-term heart health. So Ayurveda is influenced by, is influenced by 3 doshas. If anybody's familiar with Ayurveda, there's 3 main doshas. You have your Vata, your Pitta, and your Kapha. So all 3 are involved when your heart is involved. So your Vata governs your circulation and the rhythm of the heart. Your Pitta governs your emotions, your awareness, and your responses. And then Kapha provides structure, stability, and prevention. The things that affect this are poor diet, which in America we all tend to have. Chronic stress, inactivity. Inactivity has become a major problem in our community. Inflammation can all disturb the balance, and then that will lead to cardiac disease. So the first step to healing from that is actually removing what causes the harm to the heart. So what kind of things are they? They're your fried foods, they're your trans fats, they're excess sugar, excess salt, processed foods, and reheated oil. Reheated oil, ladies, is really unhealthy. If you've done tarvano in one tail, please get rid of it. Or do not heat that again. Use it in some other format where you're not going to heat it, because it is one of the worst things you can put in your body. So, choosing your fats wisely. Not all fats are harmful, provided they're eaten in limited quantities. So So choosing oils, choose extra virgin olive oil. Now I know in Indian cooking it doesn't go. There are alternatives. You can use peanut, mustard, or sesame. And then avocados. In small portion, avocado is not good in a overabundance. Just because these are good for you, don't mean you can go overboard on any of these. Walnuts, almonds, chia seeds, flax seeds. And some of you may eat fish. If you do, then fatty fish is acceptable. Now, ghee is one of those things that modern medicine says absolutely not to. And Ayurveda says you may have a tiny bit as a condiment, not as a main form of oil. So, and then avoid hydrogenated oils, which are basically oils that become solid at room temperature. Deep fried foods. The goal is to choose fats that nourish your heart rather than burden it. So one of Ayurveda's greatest contribution is to use spices as medicine. You can use them through your food. Haldi, ginger, garlic, cumin, and coriander. The 5 things we always have in our masala dabba are like the best things you can add to your foods to make them healthy. And at the same time, it also helps you reduce the amount of salt you need to add in the food when you add those. Build your daily meals around your vegetables, your lentils, your beans, your whole grains, fruits, nuts, and seeds, much like the Mediterranean diet. Plant-based foods remain the foundation of a heart-healthy diet. So Ayurveda goes one step forward. It asks, can your body digest and absorb what you eat? It's really essential that you eat food, not just to eat it, but get the nutrients from it. So nutrition is not just something that goes into the mouth. It's what your body can properly digest and absorb and utilize. So I'm going to give a few suggestions that are fairly simple. Eat your meals at regular times. Chew your food thoroughly. Avoid overeating. Don't eat till your stomach is full. And choose freshly prepared food over processed food or fast food. So, how we eat matters just as much as what we eat. Avoid watching TV, talking on the phone, scrolling on the phone, working. All these things disturb your digestive system. Your nervous system should be calm when you eat to help you digest your food properly. In Ayurveda, can I show you something? Just for 1 second, I'm just going to explain something. So, what Chitra is showing is one Anjali. That's what's known in Ayurveda. Everybody's hand forms a little bit of a different size. It's based according to your body. Your food intake at any given meal should be half of what's in there should be solid food. A quarter of it should be liquid. And the other quarter should be empty for the food to churn in your stomach to digest correctly. Thank you. I thought you'd enjoy that one. And this is the reason I named my daughter Anjali. So our body thrives on routine. Try to eat your largest meal at lunchtime. The reason being, when the sun is peak overhead, is when your digestion is at its peak. Eat dinner at least 3 hours before you go to bed. And aim for 7 to 9 hours of sleep nightly. The more you do this consistently, the healthier you will be. These 3 simple rules will help you improve your blood sugar, will help you improve your energy levels, and help your overall heart health. While these are important, so is movement. Aim, like Dr. Chitra said, aim to at least work out for 150 minutes a week. You can walk, you can bike, you can swim, do yoga, Tai Chi. They're all excellent choices, especially as you get older. Strength training, though, is essential for most people. If you can strength train, if the doctor has not said no to you, then I highly recommend you do it at least twice a week to retain your muscles. Because I'll tell you, after my heart attack, when I couldn't eat, I lost all muscle tone. It really is difficult when you don't have muscle to even walk. So to maintain it, that's what you need to do weight training. And I'm not talking about 50 pounds, 2 or 3 pounds, 5 pounds. We're just trying to maintain what we have. So following my heart attack, walking has become part of my medicine. I do it every day, a couple of times a day. I do sessions of 20 minutes, 15 minutes, whatever. Recovery and prevention don't require any extreme exercising, but what they do require is that you do them regularly. Consistency is the key. Next. So stress management is equally important. As I told you, I learned it the hard way. Stress affects your blood pressure, your blood sugar, inflammation, and your overall heart health. There are ways to counter stress. You can go walking. You can go out in nature. Praying also will help you to calm down. Deep breathing or pranayama, if you're used to doing that. Being grateful for what you have in life is another form that you could use. These all will calm your mind down, which will help you lessen your stress. Manage your stress before it manages you. Because let me tell you, stress finds a way to show up in your life if you don't manage it. So now that we've gone into that, let's look at Gujarati food in particular. This is where the fun begins. The good news is Gujarati food actually is whole plant-based. It contains a lot of heart-healthy foods that are rich in fiber, in potassium, in magnesium, and antioxidants, which all help the heart. The challenge is that our modern eating habits now include excessive sugar, excessive salt, and excessive oil, all through fried snacks and refined carbs and foods like fafra and gathiyas and gyros and jalebis and magaj and bhujiyas and samosas. Those were traditionally occasional foods, not daily foods. Now we have something pretty much every day, if not multiple times a day. Combine this with inactivity, which is another issue for us. It causes obesity, it causes diabetes, and cardiovascular diseases. Next slide. So fortunately, if you can make small modifications, they can dramatically improve your cholesterol, your blood sugar, and your overall health. So reserve your sweets and your farsadas, your fried foods, for special occasions only. And you can't tell me you have a special occasion every day. So remove the sugar and salt from your cooking. So the way I recommend you do that is slowly start decreasing. If you're used to putting 2 teaspoons in, put in 1 3/4. Get used to that taste and then go down to 1 1/2. Then go down. Go down by quarters. It's not as hard as you think it is. But it just takes time to adjust. Add fiber to the rotis. Our roti na lot has 0 fiber in it. So add some other grains to it. You can add jua, you can add bajri or ragi. Add something to it so that you actually are adding some protein as well. And then one of the key things I was talking to one of the gentlemen here, Nitinbhai Shah, we were talking about meals, like traditional meals. In traditional times, we didn't eat rice and roti at the same meal. In olden days, I remember when I was young and I would go to India, afternoon was curry, bhat, shak. There was no roti. Okay, roti was in the evening with shak, or there was either dokras or whatever else, but it was never together. Okay, all together was only meant for special occasion. You need to go back to that way of eating if you want to stay healthy. First, it's really hard for your body to digest the 2 grains at one time. And secondly, it's bad for your diabetes. And as a culture, we all know how many people suffer from that. So try to cut back to where you're eating 1 grain at a meal. And then, last but least, you can have your nasta, but it can be momra, popcorn, or chana. Chanas are very good for you too, okay? Unsalted, of course. And then limit the amount of oil and reduce sodium by cutting back on papad, papadi, and okano, the 3 things that we like to eat at all meals. You can eat them occasionally in a little bit. The way we eat them, like we take okano, like we're taking shak, we can't do that. Our bodies just cannot take that every day. So keep the foods that are very nutriently dense handy in your house all the time. Yeah. No.
Previous one.
The previous one. Right there. Okay, our vegetables are very good for us. Especially if you try to incorporate dudi, turia, and okra. Nitinbhai, are you listening?
Right.
So, also dals are very good for you. Sprouted lentils, fornagavela mud, chana, all those are very good for you. Try to keep them handy. They make great meals. Garlic, ginger, and leafy greens should be a part of your daily diet. Healthy eating doesn't require you to give up any of our foods, but it does require modifications. You can have your mithai, you can have your nasto, you just can't have it every day. So here's a simple Gujarati meal plan I came up with. So you can have oats with dahi and fruit in the morning. For a snack, I would say half an apple or a pear. If you're going to have a guava, you could probably have a whole because it doesn't have as much sugar. In the afternoon, roti shak. You can have dal, just not rice. And kachumber. And then snack can be, any kind of chaat. Forgavela mug chaat is really good, it's really healthy. And then for dinner, you can have khichdi. Now, I like to make khichdi with a lot of magni dal, a little bit of rice, and some quinoa. Still tastes great. If you are not used to quinoa, I would say add a little bit at a time till you can increase it. But you know what? You hardly can tell after a while. I got my mother-in-law to eat it, so that should tell you something. She was 90. And then at evening, before you go to bed, if you need a snack, roasted chana or walnuts are very good for you, especially if you're a diabetic, because they both are high in protein. They'll stabilize your sugar overnight and keep you steady. So for those of you that are recovering from a heart attack or are under a doctor's care, always remember, follow your doctor's orders first. These are recommendations, but they're not for everybody, especially if you're under a doctor's care. In general, follow a low sodium diet. Avoid fried foods. Eat a consistent carbohydrate intake throughout the day. That doesn't mean have 2 bowls full of things at a time. It means a little bit. What it does is it keeps your blood sugar stable. Have an adequate intake of protein. If you do dals and all that, trust me, in a Gujarati diet you get enough protein. I know today's hype is to eat a lot of protein, but later I can tell you there's enough protein in all of our foods if you eat correctly. It'll help you also with your weight, but like I said, always, always, always follow up with your doctor before you start any of this if you are under care. Recovery and health is a partnership between you and your doctor. It's not just or your healthcare team. So your health has been built through thousands of small daily choices that you've made, rather than any dramatic changes, okay? Remember, modern medicine saves your lives. Nutrition will support it. Stress matters more than you think. Sleep matters. People need to get to bed before 10, because between 10 and 2 is when your body does all the repair work. It is not something that you can make up the next day or in 10 days. It's a daily thing. What your body has taken in all day today is going to get processed tonight, not tomorrow, not next year. So if you're not in bed by 10, then you've lost out that time. And some of the stuff doesn't get processed and it's floating, and that's what's going to hurt you. Movement also matters. Get your exercise daily. Consistency is the key. And lastly, this presentation, I'm glad Nitinbhai gave me the opportunity to do, is for educating you. It is not a replacement, so please don't take it as a replacement of it for anything you have been advised by your doctor. Please go to your doctor and follow those. But you are welcome to take these to your doctor and let them see if they are recommended. I work with my cardiologist. I'm allowed to take my Ayurvedic herbs along with my medicines. He is okay with it as long as I tell him what it is. He looks it up and then he tells me yes or no. And it has worked out so far pretty well for me. So for me, modern medicine really did save my life. Like I said, I had less than 10% chance of survival. I'm here today a year later. But Ayurveda has helped me reclaim my life. So together, they're continuing to guide me towards my journey for a healthier heart and a more meaningful life. And I'm hoping that something that I've said will help you towards a more healthier journey. Thank you.
Thank you very much, Ashaben. એવું લાગે છે કે આજે તો આપણું ડિનર ગયું. હા, જગદીશભાઈ કંઈ કરજો. હા, બ્રાહ્મણ છે એટલે એમને યાદ કરું છું. That's right. Oh, okay, fine. ચાલો, thank you, Ashaben. આપણા છેલ્લા વ્યક્તા છે મનુભાઈ શાહ. મનુભાઈ તથા એમના પત્ની રીકાબેને ઇન્ડિયાનામાં એમના ગરાજમાંથી એમના છોકરાએ મને એકવાર કહ્યું હતું કે અંકલ કામ પતી ગયું, હવે હું પથ્થર વેચવા જાઉં છું. એટલે પથ્થર વેચવાનો ધંધો શરૂ કરીને $multi-billion સુધી છેલ્લા 51 વર્ષમાં પહોંચાડ્યો છે. ઓરેન્જમાં એમનું મેઇન ઓફિસ છે. કેવી રીતે કર્યું? મહેનત, સહનશક્તિ, નમ્રતા, ઉદારતા. એક જ એમની ઉદારતાનું ઉદાહરણ આપું તો આટલા વર્ષોમાં એમની કંપનીમાંથી એમણે કોઈને એમનાથી છૂટા નથી કર્યા. They have never laid off anyone in 51 years of their business. લગભગ 30-35 વર્ષથી એમણે સર્વમંગલ ફેમિલી ટ્રસ્ટ અને થોડાક વર્ષોથી શાહ હેપીનેસ ફાઉન્ડેશન ચાલુ કર્યું છે ને એમના હવે એ ચીફ ગિવિંગ ઓફિસર છે. અને આપણે એમ વિચારીએ કે છોકરા મોટા થઈ ગયા, ધંધો આપી દીધો, ચાલો હવે આપણે મજા કરીએ. મજા તો એ પણ કરે છે, પણ એમની મજા દુનિયામાં વધારે ને વધારે લોકોને કેવી રીતે આપણે મદદ કરી શકીએ એમાં છે. અને આટલા વર્ષોમાં એમના જુદા જુદા સંસ્થાઓ સાથે કામ કરતા 70 બિલિયનથી વધારે લોકોને એમણે સપોર્ટ કર્યો છે. એક કહેવત છે કે સફળતા કોને કહેવાય? તો કે આપણે પોતે જ્યાં ન પહોંચતા હોય લોકો ત્યાં પહોંચીએ એટલે આપણે સફળ કહેવાઈએ. એમનું માનવું અને કરવું જરાક જુદું છે કે આપણે તો સફળ થયા, પણ સાથે સાથે આપણે કેટલા બીજા લોકોને પણ સફળ કરાવીએ છીએ. અને એને માટે એ કાયમ કામ કરતા હોય છે. એ પોતે હાર્ટ એટેકના સર્વાઈવર છે. અને છેલ્લે જે એમણે કર્યું છે તે હું 1-2 વાક્ય કહીને બાકીનું એમને જ કહેવા દઈશ, જે આપણને બધાને કામ લાગશે, જેની આપણે છેલ્લી વાત કરવાના છીએ. એક એપ નહીં કહેવાય, એક વેબસાઇટ પર બનાવ્યું છે કે આપણને કોઈ પણ જાતની તકલીફ હોય, કોઈ પણ જાતની, તો એનો જવાબ અમારા જેવાને તમે ધંધો આપો એ પહેલા એને પૂછશો myhappy.health ને, તો એ તમને ઘણા બધા જવાબો આપશે. એના વિશે છેક છેલ્લે આપણે વાત કરીશું. થેન્ક યુ. મનુભાઈ, પ્લીઝ.
જો ગુજરાતીમાં બોલીશ તો મારું ગુજરાતી સુધરી જશે ને તમારું બગડી જશે, એટલે હું ઇંગ્લિશમાં બોલીશ. Good evening. I'd like to thank Anekan Community Center, Ramkabir Mandir, and so on, organizing this very important seminar on preventing heart attacks and sudden cardiac death. You have heard a lot about preventing heart attack. I'll talk a little more about sudden cardiac death. I want to thank our distinguished speaker, Nitinbhai, Chitraben, Bhakta and Ashaben for sharing their expertise. So, but today I'm not speaking as a medical expert. I'm speaking as a patient. I'm speaking as a survivor. In fact, I'm someone by all odds probably should not be standing here today. I should have gone 25 years ago. And if my story helps even one person take better care of their heart, then sharing it will be worthwhile. Let me take you back to December 99. I was 55 years old. At the time I was living with many immigrants would call the American dream. I had built a very growing, successful business. I was working long hours, traveling constantly, eating anytime, anywhere, trying to create opportunities for my family. Life was busy, exciting and demanding. Like many South Asian immigrants, I convinced myself that health could wait. Exercise later. Regular checkup later. Managing stress later. My wife constantly encouraged me to take better care of myself, but I was an expert at finding excuses why I can't do when she asked me to do. Sometimes I even skipped dessert, not because I was disciplined, but because I knew if I eat dessert, next day she will force me to exercise. Looking back, I laugh about it now. But then came the day when letter never arrived. December 99, I suffered a massive heart attack. No warning, no preparation. One moment I was living my normal life. The next, I was in ambulance on the way to hospital. I was fighting for it. I'll tell my story what I talked during that time with my doctor, with my God. But an ambulance rushed me to hospital. Everything changed. Soon afterward, doctor performed bypass surgery. For many people, bypass surgery is a life-saving procedure. Unfortunately, my story didn't go according to plan. I had 5 bypass. One of them on circumferential, my heart. It was on the back side of the heart. It's a very difficult surgery. After cutting the ribs, they have to pull the heart out, a little bit outside. I would be on a heart machine when they can do the bypass. That didn't go too good. Okay. So, 5 bypass did, 4 of them failed within 50 days. Very unusual. Medical journal has even written about it. Okay. Mainly for doing heart surgery on the back side of the heart. So imagine being told the operation meant to save your life just did not work. It was devastating. It was bad for me, my family, and my business. Over 5,000 people worldwide had a job because of what I was doing. 20 years of challenge. Eventually, doctor put stent. It took 2 days. It was that difficult. This is old time. Uncoated stent. Took time. And this continued several times since then. Stunt within stunt, stunt next to stunt, coated stunt in one artery. one circumferential artery. I have a 6 stent, all either next to each other or with each other. Okay. In next 20 years, I went through multiple procedures, multiple hospital visits. I know more about hospital looking at the ceiling than most people know. In fact, I did suggest to St. Jude Hospital, make good looking ceilings, and they did. At one point, so every time I thought I was done, another challenge appeared. But the most frightening challenge came only 2 years ago, in April 7th, 2024. And that is called VTAC attack. Only most doctor knows what VTAC is. Okay? It experiences ventricular tachycardia or VTAC. This is the most dangerous heart rhythm disorder that can happen to sudden cardiac death. That happens when the lower chamber and upper chamber electronic signals are not talking correctly. There are scar tissues. So the one chamber says, yeah, I won't send you blood, I'm pumping. Other says, don't pump, but they're not talking to each other. Fortunately, my wife had an Apple Watch. She put on me. We measured. Immediately we called doctor, ambulance, hospital. Eventually it was 300 heartbeat per minute. It is so high, 14 doctors in hospital came, they wanted to see my Apple Watch EKG, how it was. And they were surprised to see I survived. So, many people do not survive that. Most people at 30 beats per minute for several minutes. Of course, they put an ICD, an implantable cardioverter defibrillator, which I have now. This remarkable device continuously monitors my heart rhythm. It doesn't allow, it is set. It has a 10 years battery. It's inside, it can work. But if heart goes into dangerous rhythm, it can deliver a shock that restores the normal heartbeat and saves my life. Well, 1 year later, I had another VTAC episode. My heart rate was going at, in fact, I had just finished talking to Dr. Nitinbhai Shah while walking. I had a practice every time I talk to him, I walk. My heart again, by then I was wearing, was at 180 beats per minute. Unfortunately, the ICD was set at 185 beats per minute. So it was not active. It didn't do its job. Again, ambulance, again back to hospital. In fact, he also came down to the hospital. Eventually it calmed down and they lowered that. Now at 145 beats per minute, it does its job. Today I often tell people that I carry a guardian angel inside my chest, and that is this ICD. Today, modern medicine and technology has given me years of life that I otherwise might not have had. I'm very grateful for that. But I also know that prevention would have been far better than treatment. Why this matters to our community? You already heard 2 people. There's a reason seminar like this is so important. Studies consistently show that people from South Asia, neighboring countries have developed heart disease earlier and more aggressive than most population. Sometimes 10 to 15 years earlier. We cannot change our genetics, but we can change many of the factors that increase risk. Of course, you already heard a lot about stress. Many of us came to this country with dreams, but those dreams often come with tremendous pressure, business pressure, career pressure, family responsibility, financial concern. Stress does not always show on the outside, but over time it affects the heart. Lack of exercise. Many people say, I work hard all day, and that's true. But working hard and exercising are not the same thing. Our heart needs regular movement, walking, cycling, swimming, yoga, anything that keeps us active. Movement truly is medicine. Diet, you already heard enough about diet, so I'll pass it. One thing is very clear to me. Most of us here are vegetarian. We call ourselves a vegetarian, but we don't eat vegetables. Nitinbhai is a good example of it. Right? What we eat is a carbohydrates. Okay? Alright? So, we call vegetarian salad gaspus, rabbit food. That's not me and my wife now. Out of 14 meals a week, probably 10 meals is salad. That's what we do. Ignoring symptoms. Many people ignore warning signs: chest discomfort, shortness of breath, unusual fatigue, pain in arm, neck, jaw. We tell ourselves, I'll pass. It happens. Sometimes it does. Sometimes it doesn't. I also have a message to business owners and professionals. Something, especially entrepreneurs and professionals, many of us spend dreams many of us spend tens of years building businesses, career and financial security. When in the process we ignore our health. I certainly did. What I learned simple. You can rebuild a business. You cannot easily rebuild a heart. Taking care of your health is not selfish. It is the most important responsibility you have for yourself, for your spouse, for your children, and everyone who depends on you. Today, my company is very large. We have 3,000 employees in America. We have 800 more employees in India. We support 400,000 jobs in 35 countries. 130,000 jobs of them is in India. And city of Carson, most people, I was happy to come. I've been here. We have 3 warehouses in Carson. One on this Watson Central Drive, very close here. 250,000 square foot warehouse. There are 2 more. Every working day, 140 trucks or container comes to those 3 warehouses. 140. We work 6 days, 24 hours there. So, it is everything I experienced. I learned 4 important lessons. Prevention is powerful. Regular heart attack is that one that happens. Regular checkups, healthy eating, exercise, stress management. Listen to your body. Pay attention to signals. Build your medical team. Find good doctors. Don't wait for emergency. Share knowledge. Awareness saves life. The more we talk openly about heart health, the more people we can help. After surviving, I asked myself simple question. And this is my story with the God when I had a first heart attack. I'm in ambulance on the way from my home to St. Joseph Hospital. And I'm literally saying something I did experience. I'm saying, I don't want to die. God, why me? 3,000, at that time 10,000 people depends on me. And then God comes, son, I have a problem with you. God, how can you have a problem? He says, you've not done enough good or enough bad. I'm sending you back. Do something good or something bad, then I know where to put you. 50 days later, I'm again in ambulance, rushing. And I see God. Oh, you again here? I'm sorry, God, but give me another chance. God says, I'll give you a chance. It's the last chance, you better change. And I did change. That's how all my life has gone through for the last 25 years. We established Sarvamangal Family Trust before I had a heart attack, but we started active. Last 3 years, I retired from my business. I still go every day, but all I do is philanthropy. Millions of lives are affected around the world. Okay? So, one of the everything else I have is you already have heard. I have a few things which I'll say. One is, no matter what doctors all showed about heart problem, everything, God is very discriminated. He discriminates men. He catches men. Sudden cardiac death. All of you said, yeah, you heard it. How many women died by sudden cardiac death? You will have a hard time remembering any. And there is a reason. It's not just stress. They know what to do with the stress. From their age 13, when they get first menstruation, to their marry, go to husband's home, husband's house, work somewhere, get pregnant, deliver baby, all are very stressful. So their body is trained to take the stress and then continues its menopause. All this area, men never went through all this stress. And so cardiac arrest comes to men and women. Death cardiac comes only to the man, or usually to the man. Okay? Alright? So keep that in mind, all the men sitting here. God is not nice to you. Right. So that's my story. Now I'll show you something else. Okay. We have created a web app, myhappy.health. Okay, myhappy.health. It's already been used by, million people. Okay, it is AI based. Everyone, it speaks 26 languages. You can ask question in the combination for us Gujaratis. You ask question in Gujarati, English and mixture. You can tell them, give me answer only in Gujarati, he'll give you answer in Gujarati. He will speak only one language, you can speak multi-languages. Yeah. That was a tough one. Another tough one we created. myhappy.health. Most people don't know how to ask questions. They shy away ask questions. You are sitting next to doctor and doctor says, what's next? You suddenly forget. You suddenly realize doctor is too busy. And you don't ask. Then you come home, oh, I forgot to ask doctor this. Right? Here, you can ask forever. Today, continue tomorrow conversation, continue next day conversation. Right? And best part is, you can start with a single word and let AI help finding out what's wrong with you. Right? So if you have time, I just want to demonstrate. 5 minutes or we don't have time? No. Wi-Fi is not that good here, right? Wi-Fi. Okay. I'm not going to call your house. Okay. Can do it louder. Sound didn't work. So there are avatar, a man and a woman. You can talk to whoever you want. It has extremely powerful features, many. It's unbelievable. So I'm going to do with a male, but woman can ask. All woman-related question you can ask to woman forever, and don't worry, nobody else is. We don't store any data. So here is it. I can type in or I can talk. I'm going to talk. Okay. All right, I'm going to say a single word and watch. Headache.
How long has the headache been going on?
So he says, how long the headache is going on? It's for going on for 3 days and occasionally at night time. It's going on for 3 days and sometimes it's very high headache at the night. One second. Let me just. Yeah, it's good. So, just to finish, everybody should try. It's more complicated. Little here is not that complicated. We have asked over 100,000 questions and it is answered. Okay, it is right now all the Indian languages plus Swahili in Canada, in Africa, Ghana, Nigeria, Arabic, Spanish, Portuguese, French, all major languages. The best part is you can talk in multiple languages. It will answer you only in choice of your language, which one you want to hear.
I want you to listen to this video and then we will come back to this and then we will talk about this. This is the last part and of course તમારા સવાલના જવાબ પણ આપીશું. વધારે લાંબો નથી, 3 મિનિટનો વિડીયો છે, પણ એક સવાલ આવશે જેમ ચિત્રાબેને કહ્યું કે કોરોનરી સિટી એનજીઓ કરાવો અને ક્યારે કરાવો. આ જવાબ આમાં છે, પણ એ પછી આપણે વાત કરીએ. પ્લે ધ વિડીયો.
आपने जो अभी टेस्ट की बात की, वो टेस्ट के बारे में प्लीज थोड़ा सा और एक्सप्लेन करिए, क्योंकि बहुत कम लोग जानते हैं वो इस टेस्ट को किस टाइम ड्यूरेशन पर कितनी बार कराना चाहिए.
देखिए, अब हमारे अंदर 70 ब्लॉकेज होता रहा, उसमें 30-40 साल भी लग सकते हैं, कोई तकलीफ नहीं होती है. तो पेशेंट को पता ही नहीं उसके अंदर कितनी ब्लॉकेज है और कहाँ ब्लॉकेज है, कितने नंबर्स हैं. आजकल सब प्रिवेंटिव चेकअप कराना चाहते हैं कि भाई अंदर का बताओ मेरे को, अभी क्या आगे होने वाला है. तो प्रिवेंटिव चेकअप में आगे के जमाने में एक क्रूड सा टेस्ट होता था जिसको बोलते थे एंजियोग्राफी. उसमें डॉक्टर को एक पैर से हाथ से अंदर ट्यूब डालनी होती थी हार्ट तक, और फिर उसमें डाई डाल के उसका पिक्चर लेते थे और ब्लॉकेज बताते थे. और उसमें रिस्क ये होता था कि वहीं पे डेथ भी हो सकती थी, तो एडमिट करना जरूरी होता है. तो एक आदमी को बोला जाए आपका हार्ट का कंडीशन चेक करेंगे, आपको तकलीफ नहीं है, पर आपके अंदर तार घुसाएंगे, एडमिट करेंगे, तो बोलता है साहब मैं ठीक हूँ, मेरे को नहीं चेक कराना. मैं ये सोच रहा था कोई अच्छी टेस्ट आ जाए जहाँ एडमिट भी ना होना पड़े और कुछ झंझट भी ना हो, 2 मिनट में पता चल जाए. और लकीली ये टेस्ट आ गई है. इसका नाम है सीटी कोरोनरी एंजियोग्राम. ये आजकल कुछ नहीं करता जाए. आगे ब्रेन की सीटी स्कैन होता था, आपने सुना है, लेटा के ब्रेन का अंदर का सब देख लेते थे. हार्ट इज अ वेरी फास्ट ऑर्गन. ब्रेन फिक्स्ड है तो उसके अंदर बहुत सारे स्लाइस लिया हो जाता था. लेटा दिया और 200 बार एक्सरे ले लिया और 200 को जोड़ के कंप्यूटर में देख लिया. उसको बोलते कंप्यूटराइज्ड टोमोग्राफी. हार्ट मूविंग ऑर्गन है, तो इसके लिए वो नॉर्मल वाली सीटी एंजियोग्राफी नहीं, सीटी नहीं चलेगी, इसके लिए बहुत फास्ट सीटी चाहिए होता है। तो आगे ही 64 स्लाइस, फिर 128 स्लाइस, फिर 256 स्लाइस। अब इतनी बढ़िया मशीन हो गई है, 1 सेकेंड में आपके अंदर का देख के बता सकता है कौन सी ट्यूब में कितनी ब्लॉकेज है। और इस टेस्ट का अवेलेबिलिटी अभी इंडिया में करीब हर बड़े बड़े सिटी में आ गई है, और यूजुअली इसका कॉस्ट कोई 15,000 के आसपास होता है। पर अगर इससे ठीक से हम लोग ने अपनी तरफ से बार्गेनिंग किया, बहुत सारे हमारे हर सिटीज में जहां भी हमारे सेंटर्स हैं हमने बार्गेनिंग करके इसको 7,000, 7,000, 8,000, 6,000 में भी करवा के रखा है। तो 5-7 हजार में अगर ये ब्लॉकेज पता चल जाए कोई को, और बिना एडमिशन के 1 सेकेंड के अंदर वो लोग एक डाई डालते हैं, एक एक्सरे करते हैं, और 2 मिनट में आप बाहर, और यू नो हाउ मच ब्लॉकेज इज देयर इन विच ट्यूब एंड वेयर इज द लोकेशन। सो ये टेस्ट आजकल वाइडली अवेलेबल है, और हमारे कोई भी साउल के सेंटर में जाके आदमी इसका डिटेल लेके कहाँ इतने सस्ते में होता है वो भी पता कर सकता है।
ओके, ग्रेट। टाइम ड्यूरेशन सर कि कितने समय पर कराना चाहिए, साल में कितनी बार?
ये टेस्ट यूजुअली हम लोग बोलते हैं, अगर आपकी कोलेस्ट्रॉल, मैं लोगों को बोलता हूँ देखो फिर भी टेस्ट है, रेडिएशन तो जाएगा ही, तो आप एक काम करो, पहले तो अपना लिपिड प्रोफाइल कराओ। अगर कोलेस्ट्रॉल थोड़ा भी ऊपर की तरफ है तो ये टेस्ट इनिशियली 30 साल के पहले ही हो जाना चाहिए कि पता चल जाए कुछ ब्लॉकेज है। अगर मान लेते अभी ब्लॉकेज आई नहीं है, 10-15% आई है, तो फिर 5 साल बाद रिपीट करवा सकते हो। पर अगर ब्लॉकेज 50-40 के आसपास आ गई है देन
કોરોનરી CTA કરવા માટે usually Nitin, whenever you are ready, I'll stop. So just get connected. Usually ઘણા બધા ઇન્સ્યોરન્સ કંપનીઓ કવર નહીં કરે, અને આપણે જો કરાવવું હોય છે, અમે તો રેકમેન્ડ કરીએ જ છીએ, તો આઉટ ઓફ પોકેટ આપવા હોય તો હોસ્પિટલોમાં જાય તો અમુક વાર $1,000 માંગે છે, બીજા 1,100 માંગે છે. ટોરન્સમાં હાર્બર UCLAનું ડૉક્ટર ગુડોફ અને એની ટીમે જે ડેવલપ કર્યું છે, એ લોકો તમે ફોન કરશો ને આઉટ ઓફ પોકેટ કહેશો તો 850 કેસ, એ લોકો સાથે આપણે $500 કરીશું. એની હું તમને ડિટેલ આપું.
Okay, I'll try now. I'm going to ask question in English, but I want to answer in Gujarati. મને લમડામાં દુખે છે, મને કંઈક હેલ્પ કરો. મને લમડામાં દુખે છે, આજે હું શું કરી શકું?
યુઝ્યુઅલી અહીંયા જે લખાણો આવે છે ને, એ પેલો માણસ કે પેલા બેન બોલશે આ દુખાવો ક્યારે શરૂ થયો અને અત્યારે દુખાવો કેટલો છે 1 થી 10માં, એટલે આપણે જવાબ આપીએ કે 7. આપણે તો ખાલી અહીંયા એટલું જ કેવું છે કે 7, રાઈટ? એ 7 લઈ લેશે, સાંભળે છે, એવું કે છે, અને પછી પાછું, અને એ તમારી સાથે વાત જ કરશે બેઝિકલી. અને આ ઓબ્વિયસલી કોઈ સાચો માણસ કે સાચા બેન નથી, પણ એ તમારી સાથે, એને તમારે છે ને જમણી બાજુ લિસ્ટ હોય છે, આવે તમારે જે ભાષા સિલેક્ટ કરવી એ સિલેક્ટ કરી લેવાની.
દુખાવો 2 દિવસથી શરૂ થયો છે.
બે દિવસથી દુખાવો છે અને તીવ્રતા 7 છે. પગ પર ઊભા રહો ત્યારે અથવા ચાલતા દુખાવો વચ્ચે કે આરામમાં પણ એટલો જ રહે છે.
આરામ વખતે મને દુખતું નથી.
ચાલતા દુખાવો થાય છે અને આરામમાં નથી. સમજાયું? તમને લંગડું પડીને ચાલવું પડે છે કે તમે સામાન્ય રીતે વજન મૂકીને ચાલી શકો છો?
Anyway, the thing is, you can talk hours and hours, and it will answer. It will never hang up on you.
અને મનુભાઈએ આઈ થિંક ઇમ્પોર્ટન્ટ વાત નથી કહી. આ સર્વિસ બધાને દુનિયામાં ગમે ત્યાં ટોટલી ફ્રી છે. બધી કોસ્ટ.
That's my life. My life, no, this is the most ambitious project, and it's going very well. Many places, Africa right now, in China, in India, and we are a little late in America because we want to be careful how we present it to the people here, otherwise we get sued. But we have come up with it. You will answer those questions, and it will be after a few weeks you will say that I can't live without it. Thank you.
Thank you very much. Yeah, I can have the last slide now. Questions? જો તમે કોઈ સવાલ નહીં પૂછો તો હું તમને બધાને સવાલ પૂછવા માંગીશ. એ એક વસ્તુ છે ને બીજી વસ્તુ એવી છે કે સ્કૂલમાં એવું કહેતા કે સ્કૂલ ટીચર કે સવાલ નહીં હોય એનો મતલબ કાં તો બધું સમજાઈ ગયું અથવા બધું આમ ગયું છે. આઈ હોપ કે બધું આમ નથી ગયું. આજે કોરોનરી કેલ્શિયમની વાત કરે છે, સીટી કોરોનરી એન્જીઓ, એનું તમને પિક્ચર કેવું દેખાય? આ રિયલ પિક્ચર છે. અને આ જેનું હાર્ટ છે ને એ મારી વાઈફને બહુ ગમે છે કારણ કે આ મારું છે. આ બધી આર્ટરીઓસ છે. આવી રીતનું પિક્ચર આ 2 વર્ષ પહેલા ઇન્ડિયામાં અમે કરાવેલું તેનું છે અને એનો રિપોર્ટ ને બધું જ એ પ્રમાણે આવે. એટલે જે આપણે ધારો કે કોઈને કરાવવું છે તો યુ જસ્ટ હેવ ટુ રીચ આઉટ ટુ મી. અને તમારું નામ, ઈમેલ અને ફોન નંબર જોઈશે અને તમારા નામ પર અંડર અવર ઓર્ગેનાઇઝેશન અપરિગ્રહ ફાઉન્ડેશન હું એક રિક્વેસ્ટ મોકલીશ. અને મનુભાઈ જે હમણાં જ વાત કરીને બેઠા એમણે મને અમુક નંબર સુધી કોઈને જો પોસાય એવું ના હોય તો એને આ $500 પણ ડોનેશન આપવા માટે તૈયાર છે. Of course, everything will be handled by Aparigrah Foundation. પણ તમે મને મોકલો એટલે તમારી રિક્વેસ્ટ હું એ લોકોને મોકલીશ. એ લોકો તમને ફોન કરીને તમારી ઇન્સ્યોરન્સની ઇન્ફોર્મેશન લેશે અને they will bill your insurance. કારણ કે that's the arrangement. જો ઇન્સ્યોરન્સ ભરતું હોય તો શું કામ નહીં, પણ ઇન્સ્યોરન્સ ના ભરે અથવા deductibles, co-payment, whatever, up to $500 they will charge. અને જે લોકોને એફોર્ડિંગ હશે તો તમારે અપરિગ્રહ ફાઉન્ડેશનને પૈસા આપવાના અને એટલે તમને નોન પ્રોફિટ છે એટલે ટેક્સ રાઇટ ઓફ પણ મળી શકે. બટ અધરવાઇઝ યોર કોસ્ટ વિલ બી ઓનલી $500. જેને ગમે ત્યારે કરવું હોય મને તમારે કોન્ટેક્ટ કરવાનો. હવે આપણે સવાલ જવાબ કરીએ. એ લોકો જ્યારે તમને ફોન કરશે ને એ લોકો વધારે સમજાવશે. પણ જેટલું હું જાણું છું કારણ કે ઇન્ડિયામાં અમે કરાવી જરાક જુદી રીતનું હતું અને અહીંયા બી એ રીતે બી થાય. આ બધા માટે છે ને એક ડાય ઇન્જેક્ટ કરવાની હોય છે, અને ડાય ઇન્જેક્ટ કરીએ એટલે તમારા કિડની ફંક્શન્સ નોર્મલ છે કે નહીં જાણવા પડે. હવે ઇન્ડિયામાં અમને ખબર હતી એટલે અમે 2 દિવસ પહેલા કરાવી દીધેલા અને એનો રિપોર્ટ લઈને ત્યાં ગયેલા. અહીંયા પણ તમારી પાસે હોય રિસન્ટ રિપોર્ટ, આઈ એમ નોટ શ્યોર કેટલા પણ છેલ્લા 2-3 મહિનાનો, એ લઈને જાઓ તો ચાલે. પણ આ લોકોએ મને શું કહ્યું, એ લોકો ત્યાં જ ફિંગર પ્રિન્ટ મેથડથી બ્લડ ટેસ્ટ કરીને કરી દેશે. એટલે તમારે એ વસ્તુ તમને પહેલા સમજાવશે, એટલે તમારે બીજી કશી ચિંતા કરવાની નહીં. એટલે ચાલો કે આપણે અહીંયા ગયા, આપણે જગદીશભાઈને જ મોકલીએ. જગદીશભાઈ આપ્યું, ફોર્મ ભર્યું, એમને ઇન્સ્યોરન્સ ઇન્ફોર્મેશન લીધી, તારીખ આપી, ગયા ત્યાં જશે એટલે બધું પેપર વર્ક કરશે, પછી ફિંગરપ્રિન્ટથી એમનું કિડની ટેસ્ટ ચેક કરશે ને બરાબર છે એવું આપણે માની લઈએ, એમને એક IV ચડાવશે અને પછી સીટી સ્કેનરમાં લઈ જશે. નોર્મલી અહીંયાની એક્ઝેક્ટ પ્રોસેસ મને નથી ખબર, પણ ધીસ ઇઝ સ્ટાન્ડર્ડ પ્રોસેસ. મેં અમારા બધાના 2 વાર ઇન્ડિયા કરાવે છે, અહીંયા નથી કરાવ્યા. પણ પહેલા સીટી સ્કેન કરશે તમારા હાર્ટનું, પછી એ IV જે લગાડી હશે એમાં ડાય ઇન્જેક્ટ કરશે, પછી પાછું સીટી સ્કેન કરશે, એન્ડ ધેટ્સ ઇટ. બેઝિકલી 5 કે 10 મિનિટ અંદર તો થતી હોય છે, but that's the process actually. Yeah.
So how the calcium scoring differs than this?
કેલ્શિયમ સ્કોરિંગ ચિત્રાબેને બહુ સારી રીતે સમજાવ્યું છે, પણ ચિત્રાબેને સમજાવ્યું તેમ there are 2 types of plaques that build up in coronary arteries. One is calcium, second is soft. And calcium score picks up only about calcium deposits. Calcium scoring માં soft plaque હોય તે નહીં ખબર પડે. અને આશાબેન પરફેક્ટ એક્ઝામ્પલ છે, એમનો કેલ્શિયમ સ્કોર માઇલ્ડ હતો, એટલે માઇલ્ડ હતો એટલે આપણે ગણી લઈએ કે 377 જ હશે ડેફિનેટલી. It was over under 100, અને છતાં બી એમને 100% બ્લોકેજ આવ્યું હશે. એમાંથી આવ્યું સોફ્ટ પ્લેકમાંથી, અને સોફ્ટ પ્લેક will be picked up by coronary CT angio. એટલે એનાથી તમારી આર્ટરીઝમાં કેટલું બ્લોકેજ છે, લિટરલી આ જે રિપોર્ટ છે મારી પાસે એમાં લખેલું આવે તમારામાં 5% બ્લોકેજ છે, 0% છે, 50% છે, 30%, 40%. હવે તમે સવાલ કોઈ પૂછતું નથી, પણ હું તમને સામેથી જવાબ આપું છું. નોર્મલી તમે ડોક્ટર પાસે જશો, કાર્ડિયોલોજીસ્ટ પાસે જશો તો કે આપણે સ્ટ્રેસ ટેસ્ટ કરી લઈએ, વિચ ઇઝ ગ્રેટ. હિસ્ટોરિકલી સ્ટ્રેસ ટેસ્ટ એટલે 70%થી વધારે બ્લોકેજ હોય તો જ પોઝિટિવ આવે. 69% તો ખાલી કહું છું, 50% હશે એમાં તમે નોર્મલ પાસ થઈ જવાના. હવે 50%માં પ્રોબ્લેમ શું છે કે એ પ્લેક ક્યારે રપ્ચર થાય, ઉપરનો બોલાવો આવે જવાનો, એ કેલ્શિયમ સ્કોરિંગથી નહીં ખબર પડે. તમારો સવાલ.
CCTA test છે, is it an alternate to angiogram, right heart catheterization, and the accuracy is good?
It is the next best relatively non-invasive test. તમે જે કહો છો angiogram, that is the ultimate, no question. And the advantage of cardiac catheterization, that's the medical term, the advantage of that is if you need a stent, they'll be able to put a stent that way. Coronary CTA, you do the test, you know the results, and then the next step is the cardiac cath. So that's the difference. તમને જો ફેમિલી હિસ્ટ્રી હોય, હાઈ કોલેસ્ટ્રોલ હોય, ડાયાબિટીસ હોય, ને રિયલ ઇસ્યુ તમને લાગતા હોય, ઇફ યુ હેવ સિમ્પટમ્સ, યુ શુડ જસ્ટ ગો ફોર કાર્ડિયાક કેથ. બટ ઘણી બધી વાર આપણને કઈ તકલીફ નથી, પણ ફેમિલી હિસ્ટ્રી છે સ્ટ્રોંગ, મારા મધરને હતું, આપણું લાઇપોપ્રોટીન એ વાત કરીએ કરાવી હોય, પોઝિટિવ આવે એનો મતલબ તમારા જીન્સમાં આવ્યું છે. ડાયાબિટીસ હોય, કોલેસ્ટ્રોલ હોય, ખાવાનું તો આપણે બધાને ખબર છે. એટલે તો એમાં coronary CT angio is the in between. It gives you almost same information, not exact obviously, but almost pretty good information compared to calcium score or stress test. Now, that will not. This is nothing is 100%. We can't I mean, if we have to go, something will miss somewhere, but this is as close as doing cardiac cath, except cardiac cath is invasive, multiple dyes, but the advantage is, it is the ultimate number one, and number two, they can put the stent also if needed. Yeah?
My doctor was encouraging me to have the test done in Mumbai because, mainly because they do a high resolution test, much higher resolution than here. So, is this a newer test that they do it at a high resolution?
Was that Hinduja Hospital?
Correct.
Yes, that's where we, 5 people, me, my wife, my sister, my son, and my daughter-in-law, 2 years ago. At that time, they had the fastest scanner, that's the high resolution, even faster than America.
Wow.
America, I had not heard of 512 cycles per second before. 256 is the fastest. Now I'm sure, and now I've even heard about 1024. But Hinduja Hospital had the fastest scanner once upon a time, few years back, and that is why he was telling. We all don't need to go to Mumbai or Hinduja Hospital. Fast scanner takes less time, little less radiation, but what we have here is totally fine. And what they have happened to CLL, obviously, I'm not their market here, but I'm speaking for us. Their scanner is a standalone, that's why they can do for less out-of-pocket cost. And Dr. Budov is considered grandfather of coronary angiogram, and he is right there. He reads some of the reports, not all, of course. Yeah. Well,
Nitinbhai, I did with Dr. Budov in
Yes.
February. I paid $1,200. I wondered. Yes. And it's very easy. Before we went to a Panama trip. Before that Panama trip, I'll tell you what happened. So in my case, I was going to go to Panama hiking trip for a kilometer. So I told my doctor that I wanted to do a stress test on a treadmill. So I've already had a stent with 3 years ago. So as soon as the test started, we walk on the treadmill. The EKG was already haywire, going crazy because of the stent. After that, he asked me to see if I was good. We finished the whole test and leave extra. We need extra. After that test, he said, because there was only 1 week before we were going to the trip, and he wanted me to just do this test that he's talking about. Very good. In 15 minutes, you're out with the information that they can give you. And this price is amazing. And a lot of information doctors are already telling you. But I did hiking, I still do hiking every Sunday with my group. But this is a very good price. Very good price. And it was a different institute, but same Dr. Patel is the one. I have my report if you need to see. I have it if you want people to see it. A couple of extras if you want them to see.
Is this one covered by Medicare supplement insurance with Medicare?
The Budov scheme will talk with your insurance and try. Covered part will depend upon your medical history, which we don't need to go into. But let's see if somebody, as I said before, have a strong family history, means immediate family member died of heart attack or has had heart attack, not necessarily death. 2, high cholesterol if you have, and high lipoprotein A if you have. Insurance, any insurance will typically cover it.
Because I have COPD and I have couple stent. That's what I'm asking you.
Yeah, I mean, every individual will be different, and I will not be able to answer, and even if I answer it, yeah. But that's why they wanted actually me, that I sent the insurance information. I said, I don't have anything otherwise to do with the insurance, so why don't you take care of it? Because they know what to answer, what to write, not etc. They agreed. So they will be reaching out to your insurance company and discussing whether that will be covered or not.
I have a question in regards to what is your creatinine clearance you should have when they don't do this or they will do that because of the diet?
That's what I said, kidney function. They will do PUN and creatinine. They don't need to, you don't need creatinine clearance. And they will do with the fingerprint method right there. Because you have to have that before they do the test, because the test involves injecting dye, and that can put patients' kidneys into trouble. That is the only risk of this test, that there is a dye injection part. So if your kidneys are not good, you do have to think and worry. But most of the otherwise healthy people, kidneys are fine, so you'll be okay. But it still needs to be checked, of course.
For calcium test, they can do it too.
They do it, but I did not talk to them or negotiated anything for calcium.
I had a calcium scoring done with Dr. Goodall. They only charge you $100. The whole body scan they do for some
$400.
Yeah, $400.
The body scan is totally different topic. Calcium scar, as you said, is $100. Somebody charges $150. In my opinion, younger people definitely not, because you just haven't lived enough to get enough calcium deposits. But you still can have soft blood, which are going to be missed in calcium scoring, number one. Number two, in the older population, yes, calcium scoring will have, but it still will not tell if there is a softer plaque or not. So let's say you have, at calcium scoring will give you only a number. It does not tell percentage of blockages or anything. So typically, even there, they were telling me, if your calcium score is more than 10, then we do coronary CT angio. I said, you know what? I just want the price for a coronary CT angio. Calcium score, in my opinion, is only for people who have had troubles in the past. They knew their calcium score, they have stents, bypass, this, that, and other, and their kidneys are not good, so they need to have something else. That's when you think about calcium score. Otherwise, no. But you need to go by with what your doctor says, but to argue with them. Because most doctors still are not convinced of coronary CT angio, just because it's like you're to inject dye. So,
For LP-A, besides statin, are there any new drugs coming up in the market to lower that? Because that's the culprit for problem.
Lipoprotein A, Chitra can add if you have anything else more than what I said. It's typically right now only one-time test, because it just tests whether you carried the genes or not. And you carried the genes 50%, you are unfortunate. So you have to work harder on the other 50%. In terms of drugs to lower lipoprotein A, they are still being worked on as per the young cardiologist that I know. He said it will take probably another several years. Anything else?
Yeah, they are using currently niacinamide has less flushing than niacin, and so you could use niacinamide at bedtime along with the Benadryl to prevent flushing. Yeah, antihistamine. It does have.
But that's the next step. Once one does the CCTA test and they find the soft calcium, what can a person do to lower that?
There's no soft calcium.
It's a soft plaque.
Oh, soft plaque. Yeah. It is a soft plaque. Is there, what are the steps one should take to lower it?
An excellent question, because what am I going to do if I have 30, 40, 50%? Well, I mean, the video that you saw is Dr. Bimal Chaja. And he wasn't joking when he said there are lots of places in India where you can get coronary CT done. what he has done, he is, let me give you a little background. He's a cardiologist and he was working at All India Institute of Medical Sciences. And what happened, all of a sudden, ઘણી વાર કે ને આપણને ટ્યુબ લાઇટ થઈ કે યાર આપણે લોકો શું કરીએ છીએ પેશન્ટ આવે વાતો કરીને સમજીએ બધું અને દવા 1 2 3 પ્રેશર નથી નીચે આવતું બીજી દવા ત્રીજી દવા. We don't talk about lifestyle. એટલે એનું છે sound.org. It is Science and Art of Living. SAAOS.org. એના ઉપર 200થી વધારે વિડીયોઝ છે મુકુંદભાઈ. And he has got 100,000 plus patients who have had either bypass and can't have any more bypass, can't have any more stent, and their heart is bad. And he typically likes to talk about bypass the bypass. Means if you follow his methods, you will not need to go for bypass. Now, coming back to your question, I have a 40% blockage. What can I do? Well, this is the time to make major modifications of your lifestyle. And if you follow him, I don't know, koi પણ અહીંયા હતું સનાતનમાં 2 વાર આપણે કરેલા એમનું zero oil cooking, zero sugar zero બનાવેલો અને મારે ઘરે જ બનાવવા રહ્યો તો Kina had prepared the ingredients that he wanted, ભજીયા બનાવેલા તળ્યા વગરના. And all these are, in my opinion, 70% tasty compared to traditional after 100% laiye to. But he has got examples after examples of patients whose tracks were reversed, not to zero, but 40 no 35 ne 25. But you have to be really strict to follow what he suggests. So there are lots of things that you can do.
One thing that you can also institute if you're not on a blood thinner is omega-3 on a daily basis. Because omega-3 increases HDL, which is your good cholesterol, and lowers the LDL and triglycerides. And I've had patients who only did that because they were borderline and changed. And then of course sugar, you've got to really cut.
Are there any downside of that? Any
No,
side effects?
because omega-3 is non-inflammatory. Omega-6s and all are inflammatory. So omega-3, the only downside is if you're on blood thinners, you can't take that. Or before a surgery, you have to stop.
So there are things that you will be able to do, or at least you would know that you are a walking semi-time bomb. Because it's not going to happen to 40% to 90% all of a sudden. But if it ruptures, then that's it, basically.
Yes. This is to Dr. Chitra.
Yes.
When I had a heart attack, they said that artery diameter of South Asian is 7% smaller, and that is means 14% less blood goes through. You didn't talk anything about that thing.
I did mention that we have
You did.
smaller blood
Smaller
vessels
artery.
because,
So all of you, that's the reason why India has never been a big fan of Olympic Games. Our artery, our blood, which needs to do anything, it is like 14 horsepower smaller. Everybody is running at 100 horsepower, we are running at 86 horsepower, and we can compete with them. So that's one of the major reasons India is never a big winner in Olympics, other than area like shooting, where there is no blood is running through artery. Okay? It is a concentration in India wins. But if it is exercise and running, this is how I have been done. realizing everything without anything else.
Thank you. Oh, yes.
Okay, this is a question for Ashaben. We have heard it from some people, Ayurvedic people, that Deshi ghee is better than American ghee. Is that correct?
दानादार होय
So the only reason this ghee is a little better is because the ghee that's made in India comes from a type A cow. It has a particular type of enzyme which the cows in America do not have. Now you are getting the A2 milk is the beginning because they are now starting to use those cows here for dairy. So yes, you're correct in what you've heard, but how many of us can afford to go buy ghee? I personally would rather make it myself, so I buy the local butter and make it. I would say buy organic butter and make it yourself. That is the healthiest option because in Ayurveda they also say the feelings that you put into how you cook makes a huge difference.
Amul has made this buffalo ghee. Children. So is that better than making at home?
No, it's a protein. It has nothing to do with it. So.
I forgot to say in my happy.health, you'll be very happy. Every disease you can ask, what is the Ayurvedic solution? It will answer. You can ask over the counter. You can ask home remedy. It will tell you if there is one. But Ayurvedic is a very big part of it. You try it out and let me know what do you think. Okay.
Ashaben, may I ask you one question? Sure. At a certain age, we have a difficulty for a sleep. I'm 77 and I can't sleep more than 4 or 5 hours. You may not have a sound sleep. What one can do? What are the things? Even I've tried a variety of things, reading about on YouTube and the military people, how they fall asleep very fast. Nothing works.
So, consistency, going to bed at the same time. Not watching TV for at least an hour or two before going to bed. You can read a book, but not on your phone. You can't scroll. Electronics really messes with your mind. It messes with your sleep patterns. So, but one of the things I would recommend is take a little bit of Patel and massage the bottom of your feet before going to bed for about 10 minutes. It'll help you relax. And then do some breathing exercises. Rather than spending time talking, we tend to get into a lot of arguments with our spouses right before going to bed and wonder why we can't sleep. But maybe spend a few minutes on yourself, and it really does relieve the stress out of your body, and it'll help you fall asleep calmly. But you need to get rid of, one of the main things in America is everybody has a TV in their room. The magno-electrical waves of it actually messes with your brain pattern. I would recommend, if you do have a TV, at night cover it with a towel or a blanket to prevent them from interfering. Or I would say get it out of your bedroom, put it in your living room. And then spend an hour, you can read Bhagavad Gita, you can do bhajans, you can do breathing exercises. You can read a book of any kind that actually is calming. I wouldn't recommend thrillers and those kind of books, but anything that's calming and that you enjoy doing. Those are the kind of things you should do to actually calm yourself down before going to sleep. But consistency is the key. Going to bed at the same time, You may not go to fall asleep right away, but you will.
Ashaben, another one for you. Can you put this one to rest for me and all my friends? I drink water during my meals, and there's been a lot of discussion. We always have discussion about why are you drinking water during your meal? You're not supposed to drink it. Supposed to drink 2 hours before or 1 hour before, and we've never been able to resolve that. Because the people have different opinions.
There's been a lot of debate on that, and what I would say to you is, some people like me, we need water during eating. Do not drink cold water while you eat. It messes with your digestion. So, if you're going to drink water, take small sips to help you take your food down. After you're done, wait for a little while before you actually have a full glass. But you can have water during your meal. It is not a problem. Like I said, you have that quarter of your anjali that you can fill with water. So you got it plenty. Okay?
Alright, they're almost getting ready for the prayer.
Sorry about that. I do want to say, those who already have a stent or have gone through, Viduna Park Heart Center does exactly Dr. Bimal Charger, that's called ECP, Viduna Park Heart Center. I have gone through 2 times. My brother-in-law has gone through 2 times. Each time is 6 to 8 weeks. You have to go for 30 to 45 minutes. It's very good. Since then, all my, other than this problem on ICD, we take it that has nothing to do with what help you. But your chance of any blockage, it will open up your artery much bigger. And Vienna Park Center is, to my knowledge, is the only one in Southern California doing what Dr. Charger did.
I'll explain a little more what Manubhai is telling. ECP is a procedure where they put pumps on your leg. It's non-invasive, and if anything, it's not going to hurt you in any way. But what that does is, body is Bhagwan ne bhau sundar બનાવેલું છે body. Heart ને 5 main arteries છે, પણ સાથે સાથે બીજી બધી નાની નાની આર્ટરીઓ. હવે એને આપણે ઉપયોગ ના કરીએ એટલે સુતી જ રહેતી હોય. એટલે આ devices pump કરીને they try to open up some of this, in the medical term it's called collaterals. And if they open up, they are supplying blood to the heart, and that way the main arteries, even if they have blockages, stents, etc., this will take over to now. That's what he's referring to.
What's the doctor's name or
Vienna Park Heart Center, I don't know.
Vienna Park Heart Center.
I think that's the Dr. George. He's from
Dr.
South America.
Joe Casales.
Something.
Yes.
I've been there, that's why.
Yeah. But thinking that is highly recommended those who already have a stent.
So if you want to reinforce your heart, it's a good thing to do. Nothing to lose except your time and of course whatever cost, etc. But at least there is no harm to your body. With that, starting with thank you all for being here, listening to everybody. Nitinbhai for all the audio video help, Manubhai for agreeing to do this for Bhakta community. We just hope that the message reaches much more to people in their 30s and 40s. And thank you, Manubhai, Ashaben, and Chitraben.
Well, let's say thank you once again to Dr. Nitinbhai, Dr. Ashaben Patel, and Mr. Manubhai Shah. we have really learned a lot, really, and for the benefit of everyone. જે આજે બધી સ્લાઇડ જોઈ છે, we'll share it on our WhatsApp group so people can refer to it. Plus, today's program was on our Mandir Facebook page. People want to refer to it to see, they can go back and see it. પણ આપણને આજે ઘણું મળ્યું છે. Main thing, I think the main thing which I learned, like a calcium score is enough, but that is not enough. I think it's a soft plaque, which is very, very important. And એના માટે આજે ટેસ્ટ ડોક્ટર નિતિનભાઈ અને ચિત્રાબેને જે રેકમેન્ડ કરી છે, it is very, very helpful, number one. ને ડોક્ટર આશાબેન પાસેથી આપણે we learned a lot how we can change our lifestyle to improve and also improve our health and prevent cardiac arrest. Definitely, Manukaka Payanthi, we learned how he went through the heart. He was a survivor of a heart attack. What he learned and what main thing is what good he is doing for thousands of people. So that is really, really very, very important. Main thing, again, I just want to repeat what Dr. Nitinbhai said. We like to thank our audiovisual people, Kiritbhai and Hitubai, visual, confirming with our heart health seminar. Our dinner is just soup and salad. And so we should practice this every day. Manuka Kato, I think out of our 10 meals, he's got 8 meals of salad. So, but I think it is something we should really practice for our own benefit. Right. But એના માટે, for preparing the soup and salad, for today, we have to thank our Pratapbhai, Bipinbhai, Jayesh. Let's give them a big applause. Before the Aarti, let's have really this whole heart seminar was really inspired by what happened a few weeks ago, and we like to just have 2 minutes of silence in memory of the late Roshan Bhai. So let's then we start the Aarti. Om. Om Shanti, Shanti, Shanti. Thank you so much again. And
I just want to thank people on Facebook for their time and interest. Thank you.
thank you. Okay, maybe you can either stand where you are and sing or either agar aavo ne apne aarti karsu. Nitya Pashi will have our dinner of students.